Hi, everybody. It's Kimberly. I'm an eternal life student, which simply means human. At the end of the day, that really is the only title that we need. I think people are like walking books. We each have our own stories to share, and by sharing them, we can grow stronger. And today, I have someone who's going to share hers. In fact, I'm welcoming her back again. Hi, Maura. How are you doing?
I'm doing great, Kimberly. Thank you for having me on again.
Oh, I appreciate it. This is an important topic that we're going to talk about. And just to recap a little bit from before, this is Maura Hechim, and we are talking about Tourette Syndrome awareness. And today we're also going to talk about medical advocacy. And
Right.
let's see what else she is going to talk about. I will let her speak for herself. So, welcome.
Thank thank you. Welcome. So today I want to talk about Tourette syndrome and a little bit of the brain science behind it,
Hmm.
as well as uh, some of the treatments and why medications can be why it's difficult to treat with medications, and
Okay.
how you can advocate for yourself, both for someone who has Tourette's, but also any other medical condition.
Okay.
So this can apply to more than just those with Tourette's.
Great.
And if you haven't watched the first interview, go back and watch episode 52, and it's
Yes.
on what Tourette syndrome is and then what
Mhm.
it's like to have it. Because I have Tourette syndrome, so you might see me do some movements and stuff. So that's just par for the course.
Okay. So why don't you start to explain a little bit about what it is, right? You have a little bit of information with regards to that.
So today I wanted to, like I said, discuss um, briefly what Tourette syndrome is, go into the brain science behind it a bit for the layperson, and then some ways you can treat Tourette syndrome as well as other medical conditions in general, and then how one can advocate for themselves medically. And I'll get into each of those concepts as I go along with the slides, but I wanted to say on a high level what the goals are for this topic of discussion.
Okay.
Just a brief additional background about myself. I don't remember if I said it in the first interview. I have over 20 years experience in the biotech industry in quality control. So that's testing the medications that go anywhere from the preclinical phase all the way to drug approval and beyond.
Mhm.
And I also have my own business that's not related, but just coming into the medical advocacy part, I'm coming into it both from a scientific experience point of view and understanding, as well as a person who's had a lot of issues with treatments with Tourette syndrome. So that's what I'm bringing into this discussion experience wise.
Okay.
So a brief recap, what Tourette syndrome itself is, it's a neurodevelopmental disorder um, that is characterized by sudden involuntary movements or sounds that we call tics. And these tics can range from mild and inconsequential to moderate and severe, and in some cases can be disabling. For today's focus, motor tics are simple tics that can include eye blinking, facial grimacing, jaw movements, head bobbing, to name a few.
Mhm.
And complex motor tics involve multiple muscle groups. These tend to be movements that are slower and more purposeful in their appearance, such as hopping, twirling, and jumping. And so this is important later on in the topic for understanding what a motor tic is.
Okay.
And then a vocal tic, same concept, simple, could be such things as sniffing, throat clearing, grunting, hooting, and shouting. And then complex are words or phrases that may not be recognizable but can occur out of context. For
Mm.
example, if I'm whoop talking da 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 da, and I'm having a conversation, I did those things forcefully just to give an example of what like a complex or a simple might be.
Mhm.
Um, but people in media often attribute and mock Tourette syndrome as the cursing disease. But
Right.
in fact, only 10 to 15% of those with Tourette syndrome have what's called coprolalia, which is the cursing component of a complex motor vocal tic, excuse me.
Okay.
But so to advocate for Tourette syndrome awareness, to advocate for those who have Tourette syndrome, for those who don't understand it, everybody's unique in their presentation, and the tics can change over time. You can get complex tics, simple tics, you could get cycles of tics. And this is important to know also going into this discussion, that the tics themselves can change and they can be cyclic or go away or get worse.
Mm.
In addition, for Tourette syndrome, they've discovered that roughly 83% of individuals with Tourette syndrome have what's called a comorbid condition.
Oh, wow.
So that means you can have other medical conditions in addition to, not a cause of, but
Mm-hmm.
also. So the ones that are worth pointing out for purpose of the discussion are attention deficit disorder, obsessive compulsive disorder or behaviors, behavioral or conduct issues, anxiety, learning disability, social skills deficits and social functioning, sensory processing issues, sleep disorders, and functional neurological disorder.
Okay.
So you may be wondering, well, why does this happen, right? Um, and what are some possible treatments for it? So for Tourette syndrome in general, there's 4 potential types of treatments. Deep brain stimulation, which in theory works similar to like a pacemaker would to regulate the heart. This regulates the brain. I don't know a lot about it other than that, so I won't get into that for
Okay.
today. Speech therapies as a form of function dealing with the Tourette's tics themselves. Won't get into that. That speaks for itself.
Right.
What I wanted to focus on is both the medication pharmacology aspect as well as what they call comprehensive behavioral intervention for tics, or CBIT, very
Okay.
short. So again, Tourette syndrome is a neurological disorder, which means it's brain-based. It's not a behavioral thing.
Mm-hmm.
And it's caused by a disruption or dysregulation in the brain area called the basal ganglia, with suggested involvement in the areas of the cerebellum, thalamus, and cortex.
Okay.
So just what is
Oh.
the basal ganglia? So here I have pictures. I'm going to have pictures of the brain. You don't have to memorize all these.
Mhm.
You could come back and look at this at YouTube to your leisure for those who want to
Mhm.
dig in more. And you can go on any medical websites such as Mayo Clinic or even the
Mhm.
Tourette's website, or look in any research documents that get into the actual science behind it for those who want to dig in a lot deeper. For purposes of today, I wanted to get into just what are the major functions of the basal ganglia. Because if Tourette syndrome is a dysregulation of this area, well, what is the area supposed to do?
Right.
So the area of the basal ganglia is responsible for motor control, and in particular, refining movement. For example, fine writing, hand penmanship is fine movements, grabbing stuff,
Mhm.
and letting go. Those are called refining movements or fine motor movement,
Okay.
as well as the inhibition of a competing movement. So, for example, if I'm going to push something, you don't want the muscles to be pulling at the same time. So it's either one direction or the other. So that's what's called an inhibition of a competing movement. For motor learning and habit formation, the basal ganglia sends repeated signals when you're doing something. You know, when you create a habit, you do it multiple times over and over, like 30
Right.
days or 15 days, and they say you're starting to hardwire that into what's
Yeah.
called muscle memory. So this is where it comes from. So the basal ganglia is responsible for that muscle memory.
Okay.
So that's talking to the motor cortex association as well as the parietal, and I'll show you that on the next slide. Um, but it's also involved in cognitive functions such as decision making, working memory, and procedural learning and attention. Now, working memory is, for example, if I'm reading a recipe, where am I remembering where I am in
Mm.
the steps and then being able to advance to the next step. So that's working
Okay.
memory. And then procedural learning is how to follow the step and do it in order. So the concept of steps and
Right.
then the execution of the steps. So the basal ganglia is responsible for both, as well as attention.
Okay.
And then it's also involved in emotional processing. So if you have an emotional response associated with that motor response as well, or even the five senses, that's the basal ganglia is responsible for that.
Okay.
And it's also responsible for reward related behavior. So very often people will have addictive behaviors, um, or they'll self-medicate in order to treat Tourette syndrome tics because it's
Right.
working on the reward center.
Okay.
So so this is the basal ganglia. This is an internal slice view of the brain, and then these are the areas that it's highlighting. This is
Hmm.
part of the limbic, this is the motor, and this is the sensory. The next region is the limbic system. And there's all these little components involved with that. The olfactory bulb, that's your smelling capability.
Hmm.
So I'm going to jump around on this. So the
Sure.
olfactory bulb is overlapped by the limbic system components, but it's not specifically a part of. But
Okay.
because it's overlapping, meaning it's part of many different groups.
Right.
But because it's overlapping, smells can trigger both feelings and memories because the basal ganglia is, again, associated with motor and
Hmm.
sensory and memory processing. So a smell can trigger a whole bunch of different things. And then the limbic system itself is also referred to as the primitive brain.
Hmm.
So it responds to danger signals and activates your fight or flight, but it's also activated for those who've experienced trauma. So if they have PTSD, they'll respond to what's called a trigger, and that's
Hmm.
something that tells the body, "Oh, I'm experiencing that trauma again," but you're not really experiencing it. It's causing a cascade unintentionally.
Right.
So that's important to understand that this part is being activated. And then the limbic system is responsible for your emotions, your behaviors, your motivations, your memories, as well as your autonomic nervous system. And that's important from the point of view of, is it activated and putting you in fight and flight when
Right.
unbalanced state, or is it unactivated and it's now engaging your frontal lobe? So this is calmed down. If it's balanced, it's not activated and it's now engaging the core brain areas of your frontal lobe and your temporal lobe, which are your thinking and executive function and your understanding and everything that gives you your higher reasoning.
Hmm.
So the frontal lobe, the parietal lobe, and the temporal lobe and the core regions are all your higher reasoning and higher functions and speech and everything.
Right.
Your occipital lobe is your sight, balance, your spatial. The cerebellum is involved in balance and your muscular coordination, and your brainstem it controls your heartbeat. So it's your primitive brain. The core, every animal has a brainstem and a cerebellum, and
Yes.
it has controls your heartbeat, your respiration, as well as your body temperature and all your other essential body functions. And it controls that in an automatic manner, meaning it's not conscious, it happens on its own.
Right.
Um, you do it happens without you being aware or thinking of it. And then
Okay.
the parietal lobe is important because it's important for recog excuse me, recognition of
Hmm.
sensation and body position and objects,
Okay.
its sense of space and time, reading comprehension, as well as the association between the functions of the other lobes. So if you have a dysregulation in the basal ganglia, it's sending signals to the parietal lobe, I'm out of regulation, and it's sending false signals and then which is then activating the limbic system.
Okay.
So that causes a cascade in itself and it puts you out of balance. So how do all these function together? Why do I need to know these brain areas? You don't need to remember them, but just conceptually, you need to understand that you have the core area that's being dysregulated in Tourette's, this is the basal ganglia. And is it activating the limbic system or is it deactivating it and putting you in your core function and your cognitive function? what is the human nervous system and how are things communicating? So that's this next slide I want to go over.
Okay.
For the human nervous system, you have what's called the central nervous system, which is just the brain and the spinal cord. And
Right.
then you have the peripheral systems, which extend out from the spinal cord all the way out to your limbs and your extremities. And in that peripheral system, you have what is the autonomic nervous system.
Okay.
And then within that, so that's the part that the limbic system controls. It's involuntary, subconscious, and there's only two states it could be in at one state it could be in at one time. It's either in its sympathetic state, the stress state, or the parasympathetic nervous system is active and it's in a balanced state or rest and digest.
Okay.
So only one of these can be active at a time. It can rapid fire and switch back and forth real quick, but they can't coexist at the same time. So you're
Mm.
either in stress state or not. Um, your somatic nervous system is responsible for voluntary muscle movement. So you're activating your conscious mind in
Okay.
in activating that. Like I want to walk from here to there. My brain's consciously telling my legs to walk from here to there, to activate
Right.
and carry out this action. You're not you might not be thinking legs walk here and there, but
Right.
you're thinking
Go
the
from
thought,
here
want
to
to go
there.
from here to there, and then the whole
Yeah.
brain process happens. So and that happens through neurons. So there's either sensory neurons or motor neurons. So the sensory activates the five senses, and that's what sends the danger signals to the limbic system, or the everything's fine signal, go ahead and rest and engage your higher functioning. And then
Okay.
your motor neurons are the ones that do the action. And then from here, what's important to understand, so I have all these four graphs. I have the nervous system as a whole.
Right.
This this thing here is the brain, and this long guy is what's called the vagus nerve.
Okay.
And this is important because the vagus nerve engages from the eyes all the way down to your pelvic
Mm.
region. So basically every essential function that the body has is influenced by the vagus nerve. So when the limbic system is in fight or flight, the vagus nerve is deactivated and your body is going into fight or flight mode. When it's activated, it goes into rest and digest mode, and then you're in a
Mhm.
balance state, and that's important for the CBIT skills. Cognitive behavior intervention techniques, the
Mhm.
CBIT skills. I'll get into that in the next slide.
Okay.
Um, but what I want to point out here is on the bottom left figure is the end of neuron A, let's say, and the start of neuron B. And what happens is the body sends a signal. It either receives a signal externally or internally. And so the neuron releases what's called a signaling molecule, and that's attached to receptors on the next neuron, which
Okay.
then cause an action. And then, so the signaling molecule release is important. So I'm going to work backwards on this slide. So there's five different groups of signaling molecules. There's what's called the neurotransmitters, which are all in the body, but that's the primary signaling molecules that are active in the brain. So
Okay.
they affect all the different brain functions in one manner or another. You have hormones that can be act as a signaling molecule. You have local transmitters such as proteins. You have pheromones and then different gases such as nitric oxide and carbon monoxide that
Mhm.
act as signaling molecules.
Okay.
And all of these groups of molecules can act in any of these three manners. They can act in what's called an excitatory condition. So it's like turning on a light switch. You're increasing the
Right.
likelihood that an action's going to happen. It can act as an inhibitory, like turning off the light switch or unplugging something, or it can act what's called a neuromodulator. So it acts like a dimmer switch. So you can turn up the signal, or it can
Mhm.
turn down the signal, but still allow something to go through.
Okay.
So that's important to understand that all of these five groups can act in that manner. turning on the switch, turn off the switch, or dim it up
Okay.
or down. Why is that important? Because for the neurons and the signals, all the different engagements in your body, regardless of the pathway, the neuron's going to fire and there's going to cause an action to occur. But if there's dysregulation, something's happening that's causing it to not function properly. So it's either too much, too little, or it's of altering another pathway unintentionally.
Hmm.
And there's a lot of different potential causes for dysregulation that are important to be aware of. So when you're talking in terms of stress, if you have like immediate stress, let's try like you have to get this project done by 5 o'clock or something, that's a quick stress. That's gonna amp you up real quick, but you're not gonna stay in an unbalanced state.
Okay.
Where stress becomes an issue is if you're in a chronic stress, meaning you have repeated stress over and over and over, that itself can cause a dysregulation within the body.
Okay.
Um, Trauma can do the same thing. And if you have a trauma trigger, that automatically sends you into a dysregulated state. And if you have a medical condition that's caused by dysregulation, both of these can amplify it. So if you can regulate your stress or heal from some of your trauma so you're not triggered as bad or not triggered at all, those
Hmm.
will help in terms of treatment.
Okay.
Genetic predisposition just means it runs in the family. Your body's wired to have an issue.
Hmm.
And so you might have environmental factors or stress or trauma that will then cause that medical issue to present itself.
Hmm.
I'll get into lifestyle next, but vitamin deficiencies can also cause dysregulation. For example, magnesium, B's, D, omega fatty acids, manganese, and amino acid deficiencies can cause Tourette syndrome to occur or get worse, as well as other medical conditions. And then medical conditions themselves can occur. In this case, we're talking about Tourette syndrome, but overall, the same concept occurs for all of these because they can make a condition worse or better.
Hmm.
They won't necessarily remove the condition, but it can certainly help as far as a method of attack for treatment.
Hmm.
In terms of lifestyle factors, there's a few that apply. So poor diet isn't just, I'm not just talking about um, someone's
Cheeseburger.
eating a bunch of cheeseburgers and
Right.
processed food. Right. Someone who has a poor diet will have like a bunch of processed foods and sugars and
Right.
not a healthy balance. But diet itself is also important because again, if you're and I'll get into that more later, but if you're taking certain medications, there
Oh
might
yeah.
be some foods and stuff you have to avoid. Or if you have certain medical conditions, like say, for example, diabetes, you got to regulate your sugar. Now, sugar for the average Joe isn't going to be necessarily a problem, but if you have a medical conditions where you have to monitor it, your diet's going to be pivotal for treatment. Dehydration can cause dysregulation in itself and can present like you have a medical condition when you don't. And it's just your body saying, hey, give me water. I need water to function. Um, a lack of exercise can cause a depletion in certain neurotransmitters such as serotonin or dopamine. So exercise is one of the behavior things, and I'll show that again, but that's one of the techniques you can use to re-regulate is by implementing exercise. Adding a lack of sunlight can cause a vitamin D deficiency, which can again cause dysregulation, and a disruption in sleep can cause it, but it can also be a symptom. So that one's tricky.
Okay.
I've always been an insomniac for one reason or
Yeah.
another. So that one I always struggle with. Um, Stimulants such as caffeine, for example, or nicotine can cause dysregulation in a light switch dimmer kind of way.
Okay.
And depressants, same thing, alcohol or other medications can act in a light switch dimmer kind of way. And then different medications can also have that effect. And I'll get into that um, coming forward. When we're looking at types of treatments for Tourette syndrome or other comorbid conditions, for example, there's what's called cognitive behavior intervention techniques.
Okay.
For Tourette syndrome itself, one thing that's common is body suppression of tics, which is like an intentional focus of don't move, don't move, don't move.
Right.
If you heard my first video, don't think about monkeys. The harder you don't think about it, the worse it gets, and it builds up and it hurts.
Yeah.
So that's not always easy to suppress the tics, and it's very exhausting. But another way you can do that is to what I call intentional redirection,
Okay.
or introducing a body movement that is acceptable. For example, if I have a lot of excess energy, what I used to do when I was younger is do a lot of what I call daisy chaining for crochet. I used to, with my fingers, do a lot of chains and just undo it in
Mm-hmm.
front of the TV. And what that did was you burn up the extra energy that's being released into my
Right.
system, because my there's a dysregulation in the basal ganglia. It wants to move. It's telling my body to move subconsciously. That uses up that energy, so it allows it to kind of regulate a little bit.
Okay.
Um, and then you can redirect. So sometimes if I'm getting a lot of vocal tics, I'll redirect it. I'll try humming. So humming is one of the ways you can activate, or speaking is one of the ways you can activate your vagus nerve, which puts you in the rest and digest mode. So if I'm having a vocal tic, purposely humming or singing or speaking can help you re-regulate in that moment.
Mm-hmm.
If you're in an overwhelmed emotional state, they say to do the ice bath, basically. So you can either
Uh,
take a cold shower, um, put your face with cold water while holding your breath and do that repeatedly, or
right.
stick your hands in ice water while holding your breath. And what that does is that activates what's called the dive response. So that causes your body to slow down because
Hmm.
it activates the vagus nerve. It's like as if you fell into water.
Okay.
And so it caught, and the ice water causes the body to go, oh, I might have fallen in the lake or something. It's a brain danger signal brain response that's in the primitive brain. You
Right.
need the cold and the holding of the breath at the same time for at least 10 to 15 seconds or more if you can manage it. I usually can't go beyond 15.
Mm-hmm.
Um, in order to activate that dive response. And that's a way to re-regulate.
Okay.
Some people find meditation or slow rhythmic diaphragmatic breathing to be helpful. What they found out recently is having a balanced gut microbiome
Mm.
helps helps with the vagus activate the vagus nerve, because an out of state gut biome puts you into fight or flight mode, because it's
Mm.
activating your inflammation response because your immune system's attacking whatever is going on in your gut. And
Okay.
that puts you in fight or flight mode. You're not actively in fight mode itself,
Right.
but your
You just
body's
body
responding to
thinking it.
it's
Yeah.
activating that system, which
Mm-hmm.
could be a whole spectrum of ways your body's going to react, depends on what the trigger is. So if you cut your foot, you're not going to run away thinking a bear's coming at you, for example.
Yeah.
Your brain's going to work out and remember, okay, this is what the danger signal is telling me. This is what my body needs to do. If I'm cut or
Right.
hurt, my body is going to send all the immune responses to treat that wound.
Mm-hmm.
If there's a danger, external danger like a fire or animal, my body's going to get ready to move or hide,
Yeah.
play dead. So your
Right.
body's going to respond according to the danger.
Sure.
And depending on the trigger, if it's environmental or if it's hormonal, that's going to amplify that dysregulation for the person.
Right.
Another way that you can apply CBIT techniques is through a couple different types of therapy. So this is very good for someone who's got like a trauma response or a high stress. Um,
Okay.
you do what's called cognitive behavior therapy, dialectic behavior therapy, and what I'm exploring now is somatic therapy. So what that means is you want to reframe the thoughts that actually trigger you into fight or flight mode. You
Mm-hmm.
want to work on what's called emotion regulation skills, not just for crisis where you're doing the water and the deep breathing
Right.
and the 5 sense grounding to get you out of that, oh my God, I'm triggered, into calmer, I can focus, I can engage my frontal cortex and thinking brain into this, but also for day-to-day situations. So if they say, like, for example, building positive emotions, you
Mm-hmm.
do um happy things in the morning and then in the evening and throughout the day. If you're dysregulated, you need to add more of those reward-based happy
Mm-hmm.
thoughts. And the happy thoughts shift you into rest and digest mode.
Okay.
And then if you're in overwhelmed state, again, you can do what's both internal and external environment adjustment. So if there's temperature or the 5 senses are engaged too much, darker rooms, less patterns, softer clothes,
Right.
um, less smells or no smell. Some people have like they can't handle any odor triggers. So
Yeah.
they'll have like a sign on their office, for example,
No
odor
perfume.
sensitive, no perfume.
Yeah.
Yeah. There's a reason for that because that sets off their system. So that's an example of like an external environment. And then the internal environment is making sure you're hydrated, all
Mhm.
your vitamins are in line, your medications are regulated, and you're activating your vagus nerve because the basal ganglia is also involved in muscle memory, memory learning. If someone had trauma, for example, or the tics are over and over and over and over again, you got muscle memory going on with the tics. So it happens easier without thinking. It's annoying, which is also why there's a pattern there for the individual.
Right.
But it hardwires that into your brain. So if there's any triggers associated with that tic, that's good. That trigger is going to cause
It's
that
gonna make
tic.
it happen.
It's going to
Yeah.
make it happen even more. So you
Right.
can employ what's called somatic therapy and unlearn that wiring associated with the trauma, and
Okay.
employing the cognitive and dialectic behavior models of thought reprocessing and somatic unwiring together can help you also bring your vagus nerve into engagement and then bring you back into re-regulation to a point. So it's not going to override the tics altogether, but it could certainly lessen the intensity of it or the
Right.
frequency of it, which is the ultimate goal. But that alone is not going to work in some cases. So a lot of people, if they have mild to moderate tics, they might not take medications, but they can certainly employ the CBIT skills
Okay.
without issue. So we went over CBIT techniques, which can help lower the intensity of Tourette's tics and comorbid conditions if by bringing your body into more of a regulated state intentionally.
Okay.
But now I wanted to talk about medications that are commonly used for Tourette syndrome and comorbid conditions, not the medications themselves, but as a whole,
Okay.
um, and why treatment could be so difficult in some cases for with the medication point of view. One of the issues is that medications can lower the frequency intensity of tics, but not fully stop them. And people try and medicate to stop it, and that they haven't been able to get that so far with all the different types of treatments. It doesn't happen.
Right.
Another issue is that medications can have side effects that often mimic tics, and I'll get into that further later. They
Okay.
can also have side effects that mimic other medical conditions, and the medication can alter other body functions unintentionally. So side effects, but have you might not call it a side effect itself, but it can change something.
Okay.
It can have a negative impact on other medical conditions that you might have. It can have interactions with other medications, and including foods in that category can have interactions. And
Right.
it can also cause potentially life-threatening side effects for some. So
Okay.
all those reasons are why I wanted to have this this discussion is to, because a
Hmm.
lot of people don't think about this or are not aware of this, and it can cause so much havoc, not just for
Right.
Tourette syndrome and the comorbid conditions, but for anybody who's taking any medications for any
Hmm.
medical condition. From this point forward, applies to everybody as a whole on how you can advocate for yourself medically.
Hmm.
So how we do that is to first understand your own body and how it responds to meds, to
Okay.
do your own research and to advocate for your needs with families and doctors because you know what you're feeling and you're experiencing, and the doctor's just going off of playbook.
Right.
Okay. So it's up to you to know yourself and then advocate for yourself because only you can do it. Only you know what you're going through. And what you're feeling cannot easily be translated in words sometimes to those around you. So it's really important that you learn how to do this skill for yourself.
Right.
And I'm going to go into how you do that. So I want to backtrack briefly just to show you an example. The neurotransmitters, there's multiple neurotransmitters that act as signaling transducers. For
Hmm.
example, histamine, if you're having a histamine reaction, allergy reaction, that can cause dysregulation, but that can also impact other neurotransmitters like a dimmer switch.
Okay.
Glutamate is a neurotransmitter, but it's also a common food additive.
Mm.
So it's one of the ingredients in food. So people or like for energy drinks, for example. So if you have too much glutamate and you're adding more onto it with your diet, you've got a problem that you've just
Yeah.
enhanced made it worse unintentionally.
Hmm.
GABA is usually acts as an inhibitor. Acetylcholine, that's like stimulants can affect that and depressants can affect that. So if you
Hmm.
have high or low, and you could go back and read these, I'm not going to read every single thing, but I
Right.
just want to
Right.
point out a couple, for
Hmm.
example. So acetylcholine, for example, if you have too much, it could cause anxiety. But if you have
Okay.
not enough epinephrine, that can cause anxiety.
Right.
If you have too much norepinephrine, that can cause anxiety. So you can quickly
Hmm.
see just that alone. Well, how do I want to treat this medically? Am I altering the acetylcholine path? Am I working on epinephrine or norepinephrine? Where's the
Right.
dysregulation? Unless they go in and do a brain study on you, like with all the wires and everything, and analyze all of your blood stuff for all of these components, which no one's ever going to do because it'll cost an arm and a leg and blah, 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 blah.
Right.
You're basically taking a dart at the dartboard and going, let's try this one. Let's try this one.
Right.
And that's one of the reasons why it's so hard to treat medically for different conditions, because you don't know necessarily where the dysfunction is in your body. And everybody's unique, and you can have
Hmm.
more than one area in dysregulation. And
Right.
then stress and environmental factors can add to these and cause dysregulation in a whole nother area, which will then amplify your condition in another area. So it's just like an additive effect that
Hmm.
is a big maze.
Right.
Um, for Tourette syndrome, it's primarily a dysregulation in the dopamine pathway. So dopamine's a neurotransmitter, and there's now apparently at least five different receptors, but we're looking at like dopamine receptor 1 type and dopamine receptor 2 type because one acts as an inhibitor and one acts as an exciter.
Okay.
So for when your limbic system's active, you're exciting stuff. So your body is getting the signal to move, move, move. So too much increases energy and motivation, or euphoria and pleasure, anxiety and agitation, or aggression, or hallucinations and psychosis, depending on what part of the brain is being dysregulated again, or
Hmm.
parts. And then on the opposite side, if you have medication, for example, that controls the dopamine, so it inhibits it,
Right.
you could have what's called a low dopamine effect. So fatigue or lack of energy, lack of motivation, depression, movement disorders that look like Parkinson's disease. You could have cognitive impairment or other symptoms and disruptions in digestion and sleep disturbance, because now you're turning it off and you're
Hmm.
engaging the other aspect of your limbic system, your nervous system, but it's still dysregulated because what happens is when you have a normal signal coming in, it tells your body to do something, and then it sends the signals out to the proper parts of the brain. And then when that signal is active and then the danger signal goes away, the body goes back to balance. When you have dysregulation, either it's receiving false signals and acting on it, or it's sending out the signals in the wrong way, in the wrong timing, or a combination thereof. What happens with medication is when you add medication to the mixture, it is then attaching to that receptor, either in addition to and amplifying or decreasing the signal like a dimmer,
Okay.
or it's preventing that from acting altogether, so it's not sending the signal down the line. But because it's a medicine that's in your body, it's not receiving outside information. It's now internal, and it's going to stay as long as that system medication's in your body. So the sensation is different, the cause is different, and then the action response is different and is prolonged depending on what they call the half-life or the lifetime response of that medication within your system. So, for
Hmm.
example, Tylenol is a pain reliever that has like, I think it's a 6 to 8 hour window,
Hmm.
therapeutic window. So you take it
Yes.
every 6 to 8 hours because it's out of your system in that amount of time and has stopped working. So now you're adding more. Some medications last days, some last minutes. So it's all depending on
Right.
what you're taking and how it's working and impacting the brain. So, for example, if you're taking an antipsychotic or any other drug that's affecting the dopamine symptom, you can have life-threatening level responses, and that's in a rare case.
Mhm.
But for way too much medication or way too much response for that individual, um, another one is called QT prolongation. So that is a condition that may change the way the heart beats, and it can cause fainting or serious side effects. So
Right.
the antipsychotics drug class as a whole can cause this while you're taking the drug.
Mhm.
And it can, if you have that actual medical condition of QT prolongation, it can amplify that medical condition. And I'll go through it later on. I'll show you where to look. But sometimes like serotonin related drugs, you can't take it at the same time as something that
Hmm.
might affect QT prolongation.
Okay.
The one that's of most interest is what they call extrapyramidal symptoms or EPS. And I listed a bunch underneath just for point of fact. So Parkinsonism is basically what looks like Parkinson's symptoms. If you have too much dopamine inhibition,
Right.
you're gonna basically get really slow. You're gonna move like a zombie. You can have slowed movements, rigidity. You can have instability in your posture because of where it's activating or deactivating of the brain.
Right.
The opposite spectrum is tardive dyskinesia. So that's abnormal or involuntary movements that can affect various parts of the body. And what's important to note is that that side effect can become permanent even when you
Even.
discontinue. And then I listed a few athetosis or slow writhing movements like in the hands or the feet, dystonia, which
Mhm.
could be intermittent or sustained muscle contractions that can cause twisting or abnormal posture.
Okay.
Chorea, which is involuntary, irregular jerking motions, and akathisia, which is an inner restlessness and the inability to sit still. There's a whole list of different types. I just chose these as an example.
Hmm.
So basically, the take home message is these are the like types of symptoms that someone who doesn't know might think, oh, that person's having more tics. Let me give them more medication. And this was my living nightmare for years, is because they kept medicating me and it would get worse. And it was a vicious cycle because they kept thinking I was having more tics and more tics and more tics, but I was actually having a side effect to the medicine because it was started affecting multiple different brain areas that
Mm-hmm.
weren't intended. Um, so I'm now like writhing on the floor, looking like I'm having a grand mal seizure. I
Right.
actually got to the point where I was having NMS, and they had to rush me to the hospital because I had trouble breathing, and I'm actually in the hospital, stopped breathing, and
Right.
they had to give me what they call counter medications. So, but they still were learning about all of this stuff. And when I had received the medication, that type of medication class originally, because Tourette syndrome wasn't discovered until 1970. And then when
Right.
I was diagnosed, I was 10, so I'm going to age myself right here. In 1980, it was still new. So there was no treatment available. It was hardly known. It was just starting to get into the medical community. Hey, this thing exists. So there was
Right.
very few doctors that knew about it, and no treatment. So what they did was they didn't know how it was impacted. They didn't have any brain studies or any of that done at the time. So they were taking total guesses as to what
Yeah.
brain area. So they would go down the list. Let's try this type of medicine class. Nope. Let's try this one. Let's try this one. So they were doing what's called an off-label use of all the
Mm-hmm.
different medications, trying to take a guess of what might help.
Right.
So when they honed in on the antipsychotic class, they saw that that had the most bang for the buck, the most help, but they
Right.
didn't realize that it was causing all these other things, which they thought were the ticks. So even the doctors were treating it like it was the ticks and not realizing they were side effects. So,
Wow.
and even to this day, there's a lot of doctors who are now still learning about Tourette's and don't know about it, and they still think they treat it as if it's ticks and not
Right.
side effects.
Right.
One thing that I personally noticed with this was that, and I don't know, should actually do a poll, I'm curious, but do you notice the ticks versus a medicine side effect? Have you experienced a medicine side effect and are you aware of it? Like, does it feel different for
Ah, the
you?
awareness versus not, right?
Right, because when my body's in tight contraction or I'm got a you can't, I realize you can't see me probably in this thing, but
Right.
if you have a slight hand tremor, is that, a medicine side effect or a tick? Or if I got a hand jerking tick and all of a sudden I'm rolling my shoulder back and I'm twisting to the side, you might think, oh, that's a complex tick, when
Right.
in fact I'm having a major side effect and I need help. I need medical help to counter what's going on in my body because I have too much medication going on. My body doesn't, it's handling it in a bad way. When my For me at least, when that was happening to me, I could feel it. It feels different in my system.
Mm.
Um, there's a difference between like a premonition before a tick happens sometimes, if it's a really bad tick or a tick
Right.
episode where I'm gonna like be head bobbing a lot or moving my hand a lot. There's like a OCD component and a tick component where you feel the relief. For me,
Right.
when I was having the medicine side effect, there's no relief. It feels like hell. My muscles burn. I could feel my acid build up because it's not a normal flow of movement.
Mm-hmm.
It's an over contraction that's going on. So if you ever had runner's cramp, think of
Mm-hmm.
that across your entire body. It's extremely painful. So that's like an example
Right.
of I can tell it's not it's not my
Mm-hmm.
normal, that something
Right.
is going on. So if you're advocating for somebody, that's important to listen to have them describe things and listen for any changes and try and get them aware. Like if you're the parent advocating for your child or a loved one, listen to the words they use, ask them specific questions. Does it feel the same? Does it
Right.
burn? Does it stab? Does it burn? Does it like act like a itch or a tickle? And then does it feel better after you've done the motion or the vocal?
Mm-hmm.
Those are pivotal for understanding to help differentiate medical side effect versus an actual tick, at least in
Okay.
my personal experience for that. For serotonin, same concept. That one's involved with a lot of comorbid conditions. Low serotonin can cause mental health issues such as depression, anxiety, and mood disorders, a lot of physical health, sleep problems. For this one, the high serotonin causes serotonin syndrome, which could be life-threatening. So just like with
Mm.
dopamine, the NMS could be life-threatening.
Right.
Serotonin syndrome can be life-threatening, and I'll go over that on the next slide. But remember when I said diet can impact, um,
Mm-hmm.
can have an impact, positive or negative? If you have low serotonin, these are some things that have been proven naturally to boost serotonin levels. So kava, passion flower, valerian, chamomile, lavender, excuse me, lemon balm, tryptophan, which is found in turkey and warm milk, for example, ashwagandha, and L-theanine. And I bring those up because a lot of those are in a lot of the over-the-counter things like sleep
Yeah.
aids or even energy drinks, and now even
Mm-hmm.
coffees, mushroom coffees have
Yeah.
ashwagandha and stuff. So if you're taking an antipsychotic class medication, or if you are already on a serotonin enhancing medication, you need to be careful about taking these, that you're not kicking yourself into a dangerous
Right.
situation and developing a serotonin syndrome.
Mm-hmm.
So just like NMS, serotonin syndrome could be dangerous. So, and which is why I'm going into more depth of those specific side effects because they're important to understand. So signs and symptoms of potential serotonin syndrome could be mental status changes, for example, hallucinations, delirium, coma, when it's like you're completely over the edge on that. You can
Right.
have autonomic instability, so that can include blood pressure and heart rhythm changes,
Right.
dizziness, what they call diaphoresis, which is excessive sweating, or
Mm.
flushing, which is a reddening of the skin due to increased blood flow. You
Right.
could also have hyperthermia. So that's the body temperature not able to regulate. And that's important distinction. It's not due to an infection or a fever. It's the system can't cool itself off because that part's being dysregulated.
Mm-hmm.
Um, Neuromuscular symptoms such as tremors, rigidity, myoclonus, hyperreflexia, and incoordination. And those are just the like the level of contraction and stuff. That's saying all the body move parts are involved and it's like really rigid versus just a hand tremor. So
Right.
all these fancy labels, I looked them up on um on the web. You could do a simple search. What is blah? And that'll tell you what the layman's version of it is, which is why I threw
Mm-hmm.
a couple in there. For example, um, high blood pressure or stuff like that. And you can also have seizures or gastrointestinal symptoms such as nausea, vomiting, and diarrhea. So again, those could mirror other symptoms. Like you might think they have a stomach bug, but in fact, they're starting to show
It's a
signs of
symptom. Right.
serotonin syndrome. And you want to understand the severe ones from a medical standpoint. If regardless of what medication you're on, you want to know what class of drug you're in and how it's supposed to work, and I'll go into that a little more. But what the potential life-threatening symptoms are that you want to watch out for, because that cascade can happen really quick. For
Mm-hmm.
example, depending on the type of meds and your diet and all your circumstances surrounding it, it can be a matter of minutes to hours for that response to kick you from a light tremor into I'm in the ER and I've stopped breathing.
Right. Right.
Um, so that can happen. I had complete loss of motor function one time over the matter of minutes. So I started out talking, and I played that in the first interview.
Mm-hmm.
Um, where I'm holding the phone just for point of, so if you want to search it, for example, I'm holding the phone up to the microphone so you can hear. I recorded an event I was having for the doctor because I wasn't sure what it was called and like how
Right.
to treat it. So I went from a light hand tremor to a really severe hand tremor to a full body tremor. I wasn't able to speak anymore or clearly because I had like this.
Mm-hmm.
So I went within a matter of 4 minutes. And then I lost function of my legs. So I was stuck in the couch for hours until I got function back
Right.
in my legs. And I was taking multiple counter medications to override what was happening in my body. And that
Right.
was just in minutes. So it's really important that you're monitoring yourself for potential side effects. Not that you have to be neurotic, but you certainly need to be aware.
Yeah.
And then so for serotonin syndrome, it's important to know the potential cause. There's multiple potential causes for that one. So you can be taking serotonin, norepinephrine reuptake inhibitors, also referred to as SNRIs.
Mm-hmm.
You could be taking selective serotonin reuptake inhibitors, referred to as SSRIs. You could be taking it concomitantly so basically at the same time as other drugs, which can amplify the effect of the serotonin.
Mm-hmm.
Um, and I list them there. Or you could be taking drugs that impair the metabolism itself, called MAOIs. And
Right.
I list those on purpose because if you're taking like a decongestant, for example, a lot of
Mm-hmm.
times it'll say do not take within 14, if you're taking MIOIs or within 14 days of taking an MIOI, because it will jack you up and kick you into potentially into serotonin syndrome because
Right.
of the way that the pathway for the one drug is working and then residual issues from the other drug. So you want to be aware of what you're taking in that regard and why you're
Mm-hmm.
taking it and then what not to take with it. And I'll go into
Right.
the how you can figure that out next. So like I mentioned before, it's important for you in order to advocate for yourself medically and become your own medical advocate, you need to know what your needs are and what you're communicating. You need to know your medical conditions or your
Right.
symptoms, at minimum, your symptoms, ideally, what conditions you have. And you also need to have an understanding of how your own individual body works and how
Mm-hmm.
it responds, not just from a medication effectiveness point of view, but also medication side effects, as well as medication and food interactions.
Mm-hmm.
And I threw this bell curve up here for just for illustrative point of view. There's many different maths involved with the medications. So this is not
Right.
a stand all symbol for all the math. No, it's just for point of discussion. So, for example, the bright yellow part is basically majority of people.
Okay.
So let's say I'm going to use easy math. Say 80%, 68 to 80% of people respond in with an effective dose. So the typical
Right.
dose on the box, and to respond appropriately so it does what it's supposed to do, and there's little to no side effects. That's the bright yellow, for
Okay.
example. On the middle orange on the left might be, for example, they need less dose. And then the middle orange on the right would be they need a higher dose to have the same effect. And then the dark orange would be they need very little dose, like baby dose. So for me, I usually start out at the baby dose because I'm
Right.
highly sensitive to medication. Um, and I've had it where I've been in the ER multiple times because of it for from life-threatening level where I start out at the lowest possible and sometimes even cut that in half. Especially
Right.
for new drugs, I'll cut it in half. Um, and then I'm also monitoring myself for every potential side effect possible because I know myself and I'm usually that 0.1%. In
Yeah.
fact, in fact, I'll show you the black box label, but I was actually that one incident for Haldol.
Oh no.
I was the very first incident for Haldol for withdrawal symptoms.
Mm-hmm.
So yeah, so you got to know yourself.
Right.
So
Right.
knowing that about me, I know I need to start out low and I need to monitor for side effects. If you're the
Mm-hmm.
opposite side of the spectrum, you need so you need to know what's the max dose you could do and also side effects. So there's
Mm-hmm.
dosing and effectiveness parameters you need to be aware of because sometimes if you take too much, it could be toxic for your system or
Right.
it can interfere with other medications you might be taking, other medical conditions, as well as you need to know yourself from a side effect point of view. Does that make
Okay.
sense?
Yeah.
Okay. So let's dig into that a little bit more. So what I recommend is to keep a medical journal. So you want to
Mm,
list your symptoms with unknown causes
okay.
and list your symptoms with known medical conditions because you might not
Mm,
have everything related to the medical condition, but you have some things, so you want to be tracking changes over time.
okay.
You want to know what current state your condition is in your journal. So, are you currently stable and your treatments are working, or are you unstable or untreated and you're trying to figure it out and get it under control?
Mm,
Because that's important to note as well when you're tracking and once you get stable, what's working for you, what's not working.
right.
You want to know your treatment status. So, are you untreated? Are you treated? With what are you being treated? So, what medication type and what dose and frequency? When did you start it? Um, what treatment purpose are you using it for? Are you using it off label like they did with me originally with for Tourette's for Haldol,
Mm-hmm.
or are they using it on label, meaning the intended use that's on the box?
Right.
Okay. Are you suspecting any issues related to the medication? So either an interference with another medical condition or a potential side effect, or
Hmm.
no effect, maybe try something else. So those are the types of things you want to document. Cannot stress this enough. If you're having any side effects, like motor related side effects, take a video. Take
Mm,
a
yeah.
video from the very start, keep it running. You can always go back and show the doctor a snippet of time.
Right.
And the reason why I say this is it's important both to document what's happening and when and how fast it's progressing. Because if it's a slow progression, you might just need a minor dose. If you're having a rapid progression, you're way too high, or it might be completely the wrong medication for you. So the rapidness of the progression is important, but also what's happening is important. So for example, and I went into an example in the first interview as well. So an example would be the type of hand gesture or tremor you have. If you have just
Mhm.
a hand moving up and down, that's one type of tremor. If you have a finger flick or a rhythmic flick or a wrist twist, all those could be different types of things and different types of reactions going on.
Mhm.
That can also mean that can also help the doctor direct which pathway might be being altered um, unintentionally. So, for example, a wrist flick or a rhythmic might be Parkinson type level. I don't
Right.
remember, don't quote me per se because I don't remember which pertains to what, but I do know the type matters. So if
Mhm.
you can get a video of the type, what's happening, and then the cascade speed, those are critical. And then just bring that to the doctor and say, here's what's happening to me. I don't know what you call it and or
Right.
why. Let's figure it out and get me back in stable condition.
Right.
Um, and that's also for symptoms too. So if you're having symptoms, you could do the same thing. This is what I see. What can it possibly be? You want to also have a list not only of your past history, the medical conditions and treatments, what worked, what didn't work, but also you want to have your family medical history
Right.
for of their medical conditions for risk perspective. So, for example, if you have unknown causes for symptoms and you're trying to track down what it might be, and you have a family history of diabetes or heart disease or mental health conditions, the
Right.
doctor's going to need that information because that'll help them narrow down faster what might be going on with you.
Okay.
But also like for example, just because let's say your family history might have a history of ex or hypothyroidism, for example,
Mhm.
and you're having complete opposite symptoms, you could be hyper and they could be
Right.
hypo, but the doctor would have honed in on the oddball symptoms that go with hyper faster, knowing they have hypo, because
Mhm.
you're dysregulated in the opposite end. You're overregulated, well, they're underregulated, but it's the
Mhm.
same area that's having a dysfunction.
Right.
So And in the basal ganglia, if you remember, there's a whole bunch of lists of mental health and comorbid conditions that can be a dysregulation in the basal ganglia itself and treatment, but also other medical conditions can mirror it. So you kind of need to have a whole view of what's going on with you and bring
Right,
that with you to every appointment, or at least have it on your brain to recall so that it makes life easier when you're working with your doctor. Here's where I'm at. Here's what I tried. Here's my issues. What's our approach this time? And capture
yes.
what you tried. Capture what worked, capture what didn't. You also want to track what your general diet is.
Hmm.
And I'll go into how, again, a few slides further, but you want to have an idea of are there any food or over-the-counter restrictions or other medication restrictions for the treatments that they are either giving me now or proposing that I do.
Right,
Because you don't want to start something and go, oh, shoot, I can't mix it with it. And the doctor wasn't aware you're taking A and he assigned you B. So you
right.
need to know, he needs to know what you're on and why you're on it and the whole deal for treatment for anything going forward. So now that you have captured in your journal all the stuff as far as symptoms, medical conditions, what your current status is and your dosage, as well as your past history, yours and your family's, what you want to do next is look up the medications themselves, and also include any over-the-counter medications you may take from time to time, such as Advil or Benadryl, for example, or cold medicines, as well as any vitamin supplements you may be taking. And this even includes like energy drinks and coffee, like mushroom coffees and stuff like that, because there might be components within those OTC and supplements and energy drinks that can interfere with your medication or amplify conditions of your medical condition in a negative way.
Okay.
So how do we do that? Where do we go to look this information up? And what do we want to look up? So
So,
here I want to emphasize, I usually go to drugs.com, which is a reputable, non-open AI sourced information for drugs and clinical trials. And it's got so much information. I highly recommend it just for the information that's contained within, because you
hmm.
can look up like your symptoms, you can look up medications, drug interactions, open it clinical trials. There's so much in there that it's a wealth of information in itself. And this URL is controlled information, meaning it's verified and it's coming from like the drug manufacturers, the clinical trials, and the FDA directly. So it's
Uh-huh.
accurate information and they update it as the information pertaining to those drugs is updated. So
Mhm.
that's important to know. It's not open AI, meaning nobody can just go in and start editing it. It's a controlled website with accurate information. So I basically live off of this URL whenever I have a
Right.
question or anything. So what do we want to look at and why do we want to look it up and how do we look it up is what I want to address.
Okay.
So as far as what you're looking up, you want to look up the medication name. You want both the brand name, such as Advil, um, or Tylenol, for example, versus its generic
Right.
acetaminophen and ibuprofen as examples. And I'll show you where you can get that. You want to look up what type of medication it is, meaning what kind of medicine class is it? Is it an SSRI? Is it an MAOI, for example?
Hmm.
As well as in some instances, what's the mechanism of efficacy? Um, because it might be used in different ways,
Mm.
and it also may be used for you in either what's called an on-label or an approved purpose, or an off-label, meaning it's still in clinical trial, or they're just throwing a dart at the
Eh,
wind and going, let's try this and see what it does. Um, and with many new novel conditions or severe conditions that have no treatments, everything starts off as an off-label because they're trying to help the ones who are in the most severe condition. or in a life-threatening condition with something they think might help until someone develops a drug specifically to handle that.
Hmm.
In addition to on-label versus off-label, you want to know what approval stage it is, and I'll show you how to look that up too, as well as looking up any contraindications, side effects, and possible interactions. And those are three different things, and I'll get into those also a little bit more. I wanted to touch upon the approval stage. When something is created, it goes from preclinical, meaning it's in development stage. You're still working out the kinks for what they think is going to be the full drug. Then it goes into what's called clinical trials. So phase 1, 2, and 3 clinical trials test out the proof of concept, meaning it does what we think it does, and then is it safe? They tested
Hmm.
on both healthy and unhealthy patients, the ones with the medical condition. And then they have what's called fast track approval. And that's important to note because that doesn't mean it's approved. All that means is it's in the last phase or the second and third phase with a wide range of patients. And the FDA is reviewing the data as it comes along so that they can approve it faster. Because depending on the type of drug, like chemical drugs are easier to make and
Hmm.
they usually have a faster turnaround because it's easier to make. Biotech drugs take a lot longer and they're more expensive and they're harder to make and they're usually for more novel
Hmm.
things such as like chemotherapeutics or biotech related drugs. Vaccines fall in both more in the biotech realm, so they could be pricey depending on the components that's using to make it up, but they
Hmm.
all have their own type of approval process and safety checks and everything involved. And that changes throughout the years as regulations change. I won't get into that, but the phases themselves and the concepts don't change. There's also what's called an emergency use authorization or an EUA, and that's critical to understand because that's usually used when there is a novel or life-threatening condition. Novel means new. So like
Hmm.
COVID when it first came out,
Right.
and they were using the COVID vax in an EUA approval.
Okay.
So that's important, and I'm not going to get into the politics of the jab or anything. I'm not going there. But what
Right.
I want to understand is the difference between an EUA approval and a full approval.
Hmm.
So an EUA usually occurs if it's novel and life-threatening, and there's no other treatment options around available. So if something's in an EUA status, if you're taking it, you're automatically a clinical trial patient.
Yeah.
So you have to understand that because the safety data is being collected and you're one of the people who it's being collected on.
Right.
So if something is EUA approval, they don't know everything about it. They
Hmm.
don't know they're still trying to either determine dosing or efficacy and safety. So all of that is still being constructed as you go along until you receive what's called full approval. So,
Okay.
and full approval means it's been approved at XYZ dose for XYZ use.
Okay.
And oftentimes, if something is going to be used off label, they use an approved drug and use it off label, which could be for some completely different thing than it was um, identified for. For example, when they gave me Haldol, which is used for schizophrenia patients to treat Tourette's because of the dopamine pathway, they
Hmm.
chose something with a similar mechanism of action. So that's where the mechanism of action, and that I meant action instead of efficacy. So you need to know the medication class as far as interactions and then the mechanism of efficacy in case they're trying to target multiple different things. Or if you're taking something that affects the serotonin, for example, and then they turn around and give you something that affects dopamine, you need to,
Right.
or acetylcholine, you're going to run into trouble just for the medicines interacting with each other.
Hmm.
And they may cause them to amplify, they may cause serious side effects, they may nullify each other. And then
Right.
so the doctor might up the medication, not realizing the other two are causing a problem.
Okay.
So That's why you need to become your own advocate in this case, because the doctors don't look everything up. It's not their job to look everything up. Their job is to understand, diagnose, and give you the medicine, and they're trusting that the information that they plug in, oh, you have this, and then it gives them what medications to choose from. They pick one and go move down the line if it doesn't work, because they're not the chemists. They don't understand the whole how it works and all that. They're
Right.
just churned out a list of potential medications and go from there. So what am I looking at? If I go to drugs.com, I wanted to show you, and I'll show you where you get this, but examples of approval status, what it might look like in the
Okay.
system. So if I looked up Zoloft, it says initial US approval in 1991. So that's an example of full approval.
Mm-hmm.
Ozempic, it's been all over the news lately. So
Yep.
Ozempic has no generic. If you remember, I said brand and generic. They're telling you right here there's no generic available yet, but they do have different names for the same brand of drug. So the
Okay.
generic name of the drug, or the brand name of the drug, but the drug name, it excuse me, this is where it gets confusing. You have the brand itself, so like Advil. You have
Right.
the drug itself, which is semaglutide. I'm sure I butchered that. Semaglutide.
Okay.
Usually that would be the generic name, but it's not.
Okay.
Once there's a generic drug, meaning someone else is producing it, and they don't have to go through all the same requirements as the main manufacturer, it's going to have the generic name semaglutide, because that's the drug itself is the semaglutide. But they are
Okay.
selling it under three different brands for three different purposes.
Okay.
Ozempic was originally prescribed and approved for adults with type 2 diabetes, but it's currently in a clinical trial for weight loss. So I
Mm-hmm.
so I flagged it as two examples here so you could get an idea. It's used on label and approved for diabetes,
Mm-hmm.
off label, but in an approved trial for clinical trial.
Okay.
Here's an example of the vaccine. So this is a COVID vaccine. It received FDA approval for a specific group of people, individuals greater than 12 years of age. It received an EUA approval for individuals 6 months to 11 years of age for this particular COVID vac. There's a ton of different COVID vaccines out there.
Right.
For this particular one, it has both an FDA and an EUA, and the population of approval is different. So
Okay.
I wanted to point that out just so you get an idea of where it might be have an EUA still, because they're still doing clinical trials for that age population for this particular COVID vax. But it's got EUA approval at the moment, and that if something's EUA, you don't have to accept it. So you
Mm-hmm.
could, like, if, for example, if it's on if you have a vaccine mandate list, for some schools have a vaccine mandate list. If something is in an EUA approval, you don't have to accept that. It shouldn't even be on the list.
Right.
But without getting into the politics of it, you need to
Mm-hmm.
understand the difference between the two types of approval.
Okay.
Here's an example of a biotech drug that's in clinical trials. So it's investigational. It's a monoclonal antibody, so it's a biotech drug, and it's received fast track designation. So it's in the fast track group. So hopefully they can approve it sooner. So that's an example of something being fast tracked. They have to say that it's fast tracked or
Mm-hmm.
whatever, or EUA approval. That's required in the drug pamphlet insert, whether it's a
Okay.
EUA or a clinical trial. That when you go and you get a drug, you get a prescription filled, and they give you this thick packet of information about the drug. That's called the drug insert. And you
Mm.
can look that up, and that information is also contained on drugs.com.
Oh, good.
It's in a bunch of different areas, but that same information is in there, so you can find what you need on drugs.com if they forget to give it to you. Or
Okay.
you could even go to the manufacturer website and request the current insert. So where do I go in drugs.com itself? this is a URL. If
Okay.
I'm looking up a specific drug or medication, you click on drugs and medication, and then you enter the drug. So you can enter the
Okay.
drug name. You could enter, like, if you don't know which one it is, say you found a whole bunch of pills and your mom puts them in well, all in one jar, and you're like, what is this? You
Hmm.
can look it up by the pill imprint sometimes.
Oh,
Um,
good.
you could look it up by generic name. So there's all kinds of different ways. You can even take a picture and do a reverse Google search on it. So
Nice.
there's a lot of different ways you can look up the potential what it is you want to know.
Okay.
Once you get there, it's gonna I use Zoloft as an example. So I typed in Zoloft and then it pulls this up.
Okay.
So on here, it tells you the name, it
Hmm.
tells you what class it is. It's an antidepressant, right? And
Yep.
it's part of a drug group of drugs called selective serotonin reuptake inhibitors, or SSRIs. So
Okay.
you just have to know Zoloft as an SSRI.
Okay.
Okay.
Say that
You
five
want,
times fast. Sorry.
no, thank you. It's okay. I know, I could barely say it once. So what you're looking for is when you pull up in the drug, it's going to tell you in the drug description area is where you're going to find the core information. It's going to tell you what the name is. It'll
Hmm.
tell you what its use is, typically antidepressant, and then the class. Um, and then you can look further down. The prescribing information will tell you what uses it's on label for, whether it's approved or clinical trial. That's the on label use. If you don't see your condition listed, then you're using it off label. So that's how
Okay.
you know on label versus off label is the prescribing information.
Okay.
And then once you're in here, you want to decide what information you want to look up. If you are pregnant or breastfeeding, you want to look this information up for sure.
Hmm.
If you are concerned in general about any potential reproductive issues, you got to go out and look up the full pharmaceutical and look up the what's called teratogen information.
Okay.
So that means it has a reproductive effect. And that's involved, and it's a lot of science behind it, but basically if there's a concern, they have to list it. You also want to look up drug interactions and side effects. So if I look at the package insert information, so I clicked on the drug information.
Hmm.
Here again, here would be the generic name. So sertraline hydrochloride is the generic name. You have the brand name is Zoloft, the generic is sertraline hydrochloride. And that's important because some interactions will list the generic and not the brand.
Right.
Again, the drug class is important. It's an SSRI. And then here it gives you more links. You can look up contraindications. You can look up warnings and precautions, adverse
Mhm.
reactions and side effects, and drug interactions. And they all might sound like they're saying the same thing, but they're not.
Right.
So a contraindication set is basically who shouldn't use it. So if there's an age range, for example, who shouldn't use it, or a population group, maybe those pregnant, or sometimes even like specific races. They found like hemophiliacs that might be used for a certain group. Um, there's all kinds of different reasons why someone would be listed or a group would be listed in the contraindication.
Okay.
Under warnings and precautions and adverse reactions, it especially those who are sensitive to medications, you want to pay attention to this. So
Hmm.
though that's the black box warning label that I referenced earlier. These are the heavy hitters. So if there's life-threatening or highly common severe side effect, it's going to put it under here.
Hmm.
And then you also want to look up drug interactions as itself. So you want to come back to this section. You might have to put the drug back in to click on each section, depending on if you can go hit the back button or not. Sometimes mine disappears.
Mm.
So here's an example of the warning section. Okay.
Okay.
So for Zoloft again, it has both the oral and the liquid. So it's telling you it was approved. This is where you find its approval.
Hmm.
Here's a black box warning. It can increase suicidal thoughts and behaviors, and that's obviously could be life threatening, so they have to list it.
Right.
I mean, it sounds intuitive, but it's not always intuitive.
Right.
Um, Also want to look down here, okay, recent major changes. So August of 2023, they updated these two sections in the warnings and precautions. So when
Okay.
you receive a drug, it was initially approved in 91, but since then they've made changes. The latest was in August 23. So you want to be aware of when you've last looked up your drug. So when you're writing in your journal, any
Hmm.
indication, contraindications or interactions, you want to note the revision date of that
Okay.
drug insert that you're going off of because they could have added stuff since then as side effects or new conditions are tested and new medications come on board because there's always going to be new medications being developed. This gets updated a lot.
Yeah, no, that's a really good point that you're making, that like pay attention to the dates of when it's been last updated.
Yeah.
People, they take it for granted sometimes and they just say, okay, I already know I had that medicine, and
Yeah.
they don't realize it's changed since then. Yeah.
Right. So so I like the fact that this one, like, because when they give you the inserts for the
Hmm.
drugs, they're just required to give you the most current, but they never flag on the insert what's changed.
Right. Right.
This this URL tells you what's changed, which I
That's good.
love. So I could
Yeah, that's
easily
good.
go back, okay, is it something I need to be aware of? So
Exactly.
I'll
Maybe
pop
now you
back
can't
in.
eat food with it, like a certain thing or something that they
Right,
found out. Yeah,
right. So
that's
like
good.
I'll pop in here and I'll click on, because it's a clickable link, I'll click on like 5.2 and 5.3 and
Right.
see what those were.
Yeah.
And if it's something I need to be concerned about.
Okay. Oh, I like it.
So again, here's a contract indication. I chose this as an example because there's a few things I wanted to highlight
Hmm.
that you might come across, and it's big words. So I want to break it down a little bit.
Okay.
So again, contraindication is those persons or groups or medical conditions that shouldn't use it.
Hmm.
So concomitant, so first, I'm again using Zoloft as my example.
Okay.
So for Zoloft, concomitant use of monoamine oxidase inhibitors, also known as MAOIs, or use within 14 days of stopping an MAOI. And that's again because the residual effect of the MAOI is having extra serotonin,
Okay.
and it can cause an issue with this particular medicine. So concomitant use means taken together, not
Okay.
necessarily at the same time, but you take both of those drugs at some point. And I'm
Hmm.
not talking well, even periodically, like I've got a cold, I need to use a decongestant. I can't use it with this if it says don't
Right.
use it with MAOI. And a lot of cold medicines tell you you can't use it with SSRIs or MAOI. So
Hmm.
you need to really pay attention to the label.
Yes.
And MAOI again is a class of drug. So if they list a class of drug, in this case MAOIs, the use of that drug is for any drug that comes in that class,
Hmm.
present and any new ones that may be developed that fall under that class.
Okay.
If they list a specific drug, for example, pimozide in this case, they have the section that it's related to, section 4 and 7.1. If they list a specific drug, you must verify whether other drugs in this drug class have a similar contraindication or warning before you take them, and you want to look at the impact of the drug listed for more information. So I
Right.
went back and looked at why can't I take it with pimozide? I looked up section 4 and 7.1, and
Okay.
in this case, it referenced what's called a QTC prolongation. And I know that's a big word, that's a medical condition in itself,
Uh-huh. Okay.
but what I found was pimozide and the class of drug, a lot of the drugs in the class antipsychotics, which pimozide is in that class,
Hmm.
have this warning. And because the drug itself can cause a QT prolongation response.
Okay.
And if you already have that condition, you can't take that drug.
Right.
So, but this can cause that effect. So the doctors need to, so you might be going in and having an EKG and then it's
Right.
showing acute prolongation, which can
Mm.
have medical implications itself if you're having like dental work or other things like
Hmm.
anesthesias can impact QT long prolongations, and then they have to monitor you. So there's all kinds of reasons why you want to look up all the different things listed in the contraindication to get a better understanding of the why behind it and if it pertains to you. Known hypersensitivity to sertraline or excipients. Again, sertraline is the Zoloft and excipients. So I wanted to define that a little bit more. So hypersensitivity can both refer to an allergy or side effects.
Mm.
And then excipients is all the non-active ingredients that help make up the product, whereas the active ingredient is the drug itself. And it's different, and the excipients are different between the brand name and each generic brand, and that's what actually is why it's generic. So the drug is the same thing. What makes it generic is someone's preparing it differently, but they're using your drug that you developed.
Right.
I won't get into the whole politics of that. I got my own opinion.
Right. Yeah.
But I wanted to show you an example just so you can get an appreciation of where on the label it might look like.
Okay.
So I chose Benadryl, and
Okay.
it's a generic called Top Care. Okay.
Mm-hmm.
The Benadryl's in pink, not that it matters, but so for example, under drug facts, it says the active ingredient is diphenylhydramine hydrochloride. And it's got 25 mg on the left one and 25 mg on the right one. And their both purpose is antihistamine.
Okay.
So that's the purpose, and then that's the drug itself in the generic name.
Right.
If you come all the way down to the bottom and you look at inactive ingredients, you'll see they're completely different between the two of them.
Mm.
That's because one's generic and one's brand, but they both have the same drug. Does that
Okay.
make sense?
Yes.
Okay.
Yeah.
And then here, under warnings, these are again like some of the black box warnings, contraindications and black box warnings that you might come across. So they put the immediate concerns on here, but these are not the end all be all. Go look it up. That's the short end of the story. Go look
Right.
it up.
That's the quick part of it. But the warning should be the same
The
in theory.
warnings, there's only so much room on the label. And
Okay.
sometimes, like if you pull up Haldol, the warning is like 3 pages long now.
Yeah. Okay.
Okay. So they have to list the top priority ones,
Right.
like MIOI. Don't use it with MIOIs, for
Right.
example, or I don't know
Okay.
what this one is. I didn't read it.
That's okay.
But they tell you like the top ones don't
Mm-hmm.
use it with, and then ask a doctor if you're taking other
Right.
medications. So the same catch-all. Ask a doctor if you're taking any other medications or anything that causes sedation.
Mm-hmm.
And then it lists the heavy hitter items
Okay.
for these particular things. But yeah, always look it up. So
Yes.
here's an example more of warnings and conditions. I talked about earlier serotonin syndrome. Serotonin syndrome is you have an increased risk if you're taking it with other serotonin agents versus but it can also occur with Zoloft, which is a serotonin agent itself. It also lists other things. I won't get into that, but again, here I looked up Pimozide, so I
Mm-hmm.
flagged QTC prolongation, and I wanted to bring that up again, not just because it's a heart related condition, so it's an irregularity in your heart rhythm. But one of the symptoms of QTC prolongation is you can have what looks like a seizure, but it's not. I
Right.
actually had that when I was taking Pimozide. I had that effect, and I had to monitor me because I looked like I was having a grand mal seizure, but I wasn't having a seizure. I was fully alert, fully aware, felt everything, and it hurt like a mofo. Um,
Right.
but because I was awake, they like something else is going on. So they hooked me
Mm-hmm.
up to the EKGs. I
Right.
actually, it took like so long for me to actually have an event occur in the doctor's office where they finally figured out what was going on. And again, I was the black box one of the one incidence of the black box label that flagged the QC prolongation because I actually had it occur in the office when,
Okay.
and the guy's like, "Oh, she's having a seizure. Get the whatever the seizure medication was to
Right,
the nurse." I'm like, "No, I'm not. This is what I've
right.
been talking about." And he goes, "Oh, wait, she's
Uh,
talking. Wait a minute, what?" Because I was
yep,
able to talk. Because if someone's
exactly.
actually, if someone, the way I looked was having a grand mal seizure, like I'm all flying, flipping out
Right,
like that. He
right,
can't see me, but I'm like flipping out like a squirmy worm on the floor,
right.
or in this case on the medical table. But I'm
But you were,
fully aware, and because I was
yes,
fully aware was the only reason why he knew it wasn't a
it wasn't.
seizure.
Yeah.
So that's where knowing yourself, recording the symptoms, and talking about it to your doctor, and don't take no for an answer. Get to
Right.
the bottom of it, because sometimes, because they're using it off label, because drugs do weird things, and because sometimes you might be just an oddball person like I am with
Hmm.
medications, and you're going to be that one person on that label because it happened now and it was life threatening. They have to record it.
Right.
So I'm that one person. There might be more of me out there, and you might be one
Right,
of them who's
right.
listening. So that's where you need to advocate for yourself in that case, because you're going to be potentially hypersensitive to everything. So I religiously look up the medications they want me to use. And I look up all the interactions with everything I'm taking,
Right.
and I look at everything. I mean, there's
Hmm.
like, because you have your normal conditions, you'll have like maybe a page of, can cause sweating, tear ducts or
Yeah,
whatever, itchiness. I look at everything all the way down to the severe, 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 because I'm
right.
probably going to be down in the severe, severe, severe.
Yeah.
So I need to know what I'm potentially watching out for. And then I'll usually, if something's going to bother me, it'll be pretty close to taking it, or within a few weeks of hitting what they call baseline. Now that, say for example, the doctor um gave you a medication and he told you it usually takes 2 to 4 weeks um for it to kick in and take
Hmm.
effect. And you are one of those sensitive souls like I am, and you start having side effects right away or within a
Hmm.
few days. That's when you want to get a hold of your doctor. Now, when you look up side effects, and I forgot the slide on that one, of course, because there's like a
Hmm.
gazillion side effects. You're going
Right.
to see them broken down into like common, mild, or moderate, and severe, and then contact the doctor if, and then moderate and severe or rare. So they're going to be a whole bunch of heavy scientific words in each combination. Um,
Hmm.
I usually start doing my homework and I'll Google search each single word of interest just so I know what it is I'm looking for and if it's
Okay.
something I need to be concerned about. And then the ones that I want to be watchful for, I'll write down in my journal, like watch out for blah blah blah.
Right.
You're not going to be concerned with mild, and even some moderate that aren't a big deal. Like it might cause some stomach distress. That's not a
Right.
big deal to contact a doctor unless it's really disruptive and you want to take care of it. And then you might have like take A with B,
Hmm.
What you want to be concerned with, especially with serotonin agents or dopamine agents, is symptoms that are potential precursors to a life-threatening event. So, for example, if I'm taking a serotonin or a dopamine agent and I start to get a light tremor within a couple hours of taking it or over a few days, I know I have to monitor myself and make sure it doesn't ramp up into that life-threatening zone. Because again, depending on how your body reacts, what dosage you're taking, and anything else that's in your diet or environment or other medications or medical symptoms you might have, it can amplify it really quick.
Hmm.
So when I take a dopamine agent, for example, I've had such bad life-threatening results with some of them that the minute I have tremor, if it's not the lowest dose already, I bump it down. I talk to my doctor, I get on the lowest dose possible, if not
Hmm.
already starting at the lowest dose possible for that.
Right.
And I know, because I know myself, I know if I start get tremors after a day or two, and I'm not supposed to hit baseline in my body for another few weeks, I'm in trouble.
Right.
So I know either I need a contra medication, I need to change the dosage, or I need to not take that medication at all. So that's again one of the instances where you need to know yourself and know how you
Hmm.
react and what category you fall in, both for dosing and efficacy.
Hmm.
And then what kind of medications you've had any issues with, if any, in the past. So having that list handy when you're talking with your doctor is very, very helpful. And
Right.
then same thing, just to remind you, when you have a questionable symptom, record it and take a video of it, especially
Hmm.
if it's motor related, like muscle related. You want to record that and show your doctor, because the type of movement again could be indicative of too much or not enough of something, or a combination of the medicines just wreaking complete havoc on your system,
Hmm.
or all the above.
Right.
So, so it's important to look at the side effects as a whole, and then what might you might want to be aware of. When you're looking at the section called adverse reactions and side effects, that's where you're going to dig into side effects. They'll list known high alert drug interactions from the get-go. For example,
Right.
any protein pound drugs for Zoloft, you can't take at the same time. Like warfarin is a blood thinner. You can't
Hmm.
take that together because it can cause severe bleeding or other issues. They have this some kind of substrate. I don't know what that's for, but that's just an example of two known drug interactions that you can't take it with.
Right.
These are two populations that cannot use, or in certain circumstances shouldn't use Zoloft. So like pregnancy in the third trimester, pediatric use, it's not approved.
Right.
So this is an example of specific population contraindication. Um, and then again, these are the two revisions that were added in August of 23,
Hmm.
2023.
There you go.
So So they just found, yeah, they found the protein bound warfarin, um, that's highlighted, and then they found the population for the trimester as well as pediatric. They found that it was, even though it's an antidepressant, in the younger population, they found it severely increased suicidal thoughts and behavior,
Mm.
ideation.
Okay.
So for some reason, it affects the younger population that way when it's against what it's used for. It's a complete
Mhm.
opposite, and they don't understand why.
Right.
They're still investigating that cause. So those are just some examples of adverse reactions and side effects
Hmm.
to be mindful of. When you go onto drugs.com, just like there was a drug or pill identifier, there's a spot called drug interaction checker. So within the drug information itself under Zoloft, it had drug interactions. I recommend you go and look at that, but you also go back to the drugs.com homepage and look up drug interaction checker. And the
Right.
reason why I say that is because you can add up to 3 at a time and
Oh,
look them up.
nice.
Yeah,
That's good.
if for the unpaid. For the
Yeah.
unpaid version, you can look up 3. So what you would do is you look up your current medications, and you just make sure you cover all the permutations. So if you're taking like 6, you got to cover 3 and 3, and then go back and
Right.
overlap anything that might have had a moderate or severe. You want to go back and double check. So when I looked up Advil, Pimozide, and Zoloft, for example, because Gavel would be, again, like an OTC drug I would take. A
Hmm.
Pimozide was a class of drug I took, and Zoloft was just a drug I chose to look up because that was in the news. So,
Right.
so it said, so it'll kick back. For example, it gave me 5 potential interactions or warnings found. So then
Hmm.
what would those look like? So let's take a look a little closer. I like drugs.com because it'll tell you exactly what's interacting or potential interacting with what. And it'll
Okay.
tell you if it's major or moderate or minor, for example.
Hmm.
And you can limit the interaction search to just major or specific things you want to look at, foods only,
Hmm.
or so there's all different ways. Again, you can play with what you're looking for in this URL, which I love because you could just go really light or really deep until your heart's
Yeah.
content. You could look up clinical information. I mean, you can really go at it and have some fun with the data dive, which I love to do. So,
Of course.
but what's important to know is like sertraline is Zoloft, and then Pimozide was the generic for an antipsychotic class.
Okay.
Remember, it said in the contraindication, it said not to use the two at the same time.
Right.
So this was a major event, and it says using together is not recommended because it can increase the blood levels of pimozide to a dangerous level, causing the heart rhythm issue. In a moderate case for ibuprofen and Zoloft, for example, it can increase the risk of bleeding.
Mm-hmm.
So that's also why, like warfarin, you can't use it with warfarin because it's a blood. I think warfarin's a blood thinner. But yeah, it'll increase your risk of bleeding. And then
Right.
here, you're looking at the interactions. I just want to point out the example when it's giving drug and food interactions, like it's saying major for pimozide and food.
Mm-hmm.
It's major because the consumption of grapefruits can interact and affect how the drug itself is working.
Yes.
Whereas moderate for food is telling you alcohol can increase drowsiness.
Mm-hmm.
So if the Zoloft is already making you drowsy and you add alcohol on top of that,
It'll be very,
you might
yeah.
be falling on the floor with just,
Yeah.
one glass. So,
Right.
but the interaction is different, which is why the category major and moderate is different. So it's important to note what the
Yes.
category is and why, and then
Yeah.
what impact it's actually having. And then is that a concern for you? Is that something you need to bring up to your doctor or what just be mindful of and not take that particular OTC drug, for example, or that medicine with it? So just to recap, because I know we covered a whole lot of information, Tourette's and comorbid conditions can have multiple possible causes. And treatments can be tricky due to the nature of the condition, as well as any other dysregulation that's going on in your body, whether it's environment, diet, other medications, or medical conditions. Because of that, it's important to know yourself medically. Are you generally a person who's sensitive to medications? If that's the case, you must advocate for yourself because no one's going to do it for you. And you'll
Right.
probably run into a lot of issues with doctors, like I ran into with, oh no, that's not an expected result or
Yeah.
side effect. It doesn't matter. I didn't have it before I took this medicine and now I do. So therefore I know it's because of A.
Yep.
One example is I took Claritin and there's not supposed to affect your motor pathway at all, but that was like the longest 24 hours of strict
Oh,
ticks of my life. It was like
right.
nonstop ticking. And I brought it
Right.
up to the doctor. He said, no, that's not because of that. I'm like, yeah, it is, and I'm not going to take it again. Put it in my
Yes.
notes. Don't give me Claritin.
Mhm.
Um, you want to keep an ongoing journal of your symptoms, your medical conditions, treatments, any changes, whether changes in treatment, changes in conditions. You want to keep a track of yourself and your family history on a high level for risk
Mhm.
assessment and diagnosis purposes. Take any videos of any concerning or suspected side effects. That's a hard one.
Right.
And to do your own research because doctors don't know everything. And then
Yes.
it's also important to work with your doctor and your support team in order to have your needs met for medically and just in general.
Yes.
So I know I covered a lot. Wanted to open it up to any questions you might have. And then also
Mhm.
just to point out, if you missed my first interview, episode 52, I talk about what Tourette syndrome is in more detail, as well as
Mhm.
what it's like having Tourette syndrome. If you're curious, go back and listen. And then also, if you have any questions regarding both this interview and my first interview, you can ask them. I recommend you ask it directly in the Facebook post itself for that thing, and I'll try and pin this newer one on the Facebook post. And I have to mess around with it, but I'm trying to make them their own tab so you can find it easier.
Okay.
Um, if you can't find the post, send me a direct message or send me a post and tag me, and I'll try and answer it. My email's currently not working right, the one I wanted to use. That's why I'm saying keep it on Facebook. But that also
Yep.
allows your question to be and the answer to be available for everybody. So you can ask it anonymously or send me a
Mm-hmm.
private message if you want. And then I might post a question. If you ask it anonymously, I might post the question itself without your involvement if you
Right.
did it private so that the public can benefit from it, just so you're aware, I might do that. So don't
Yeah.
mention names. If you want an anonymous, don't mention any names or,
Mm-hmm.
any locations or anything that would identify you as a whole
Right.
to the public. And if I like mirror the post, I'll do the same thing. I'll keep it private. Um, just so that people can benefit from that information.
Okay.
So
No,
I, so
great.
I, did you have any questions? I know we covered a lot, so.
Yeah, no, I think this topic is so important. It's not so much a question, it's more of a thank you in the fact that you're taking the time to educate people on all these things that, a lot of times people just listen to the doctor, take the medicine, and deal with the side effects, not realizing that they don't have to, right? That they can journal it, they can
Right,
mark down, and there are alternative medicines that they can take that will be, they can be just as good without those side effects. You
right,
don't just have
right,
to accept the first
right.
thing you're given, right? So
Exactly, exactly.
that's the piece I think a lot of people forget. They just think, okay, fine, I'll take it and then deal with it. But there's other things they
Right.
can do. And that drugs.com is a beautiful tool. I myself hadn't seen it before. I love it. It's great. You could see the interactions, you could see the different things that are out there. The fact that they update it and that you can pay attention to it, that is also a very good thing. I myself have learned a lot during this whole podcast
Oh,
that
good,
I
good.
didn't know. So, and it's funny because, like you said from the very beginning, you said this isn't just about advocacy for Tourette syndrome, right?
Right,
This is
right.
for any type of
Anybody.
health. Exactly. So that's
Exactly.
what I just kind of wanted to reiterate that yes, this, we are talking about it, but this is for everyone. And if they have questions, it's not just about Tourette syndrome. They can talk to you about how you use the tool and maybe they can learn from you how it could help them, right?
Exactly. Definitely.
Yes. Yeah. So no, this is very useful information. I appreciate you taking the time to break it down for us in each of the steps because I know you've used it. So you've seen it, you already know, go here, look at this, go here, look there.
Right,
Where as a brand new person who's going in and taking a look, you now just save them a bunch of steps and now they can
right.
just get right to the information that they need. So well, thank you for that. That's
Oh, you're
wonderful.
welcome. You're
Yeah.
welcome.
So, and I was gonna ask you about journaling, but you had already answered
I'm
it.
gonna I'm gonna
So,
stop the share. Here we go. Here we are.
yes.
I realized you were doing all that and I didn't have it. We're
Yep,
still
no, that's
sharing.
okay. So, I mean, basically, I agree too. Like having a journal is really important, right? That way you can track the different
Yeah. Yeah.
interactions, the side effects, which medicines are going, and then taking it a step further, go to the drugs.com, research how they can interact with each other, and then you can see whether or not is it is it the disease or the progression of something versus a side effect,
Right.
right?
And with Tourette syndrome, a lot of the movement side effects, someone who doesn't have Tourette's might think, oh, that's just a tick. And that was
Right.
like the hugest thing for me because most of it was side effects.
Exactly.
Yeah.
And they even say if you read, you hear a lot of commercials and things like that, that you can have a tremor in your hand and
Right.
as a side effect, right?
Right. Right.
Where that could also be like a tick. So, how do you tell the difference between the two? By journaling, by seeing whether or not it's something that you felt before, whether you're on the medicine, not on the medicine, all
Right.
those type of things. And so,
And then
talking to your
also, yeah.
doctor, right? Talk to your doctor, take journal, but at the same token, like you said, main thing, advocate for yourself. You know yourself best. You know how you feel. Someone can't tell you if you feel good and
Right.
you don't. They're
Right.
going to try, but they're not you. right?
And I just thought of something else too, as far as tracking that. Because if you're the parent of a kid, they might not
Yes,
identify, oh, this feels different. But one thing you can do when you're starting the journal is mark what time you gave them the medicine and at what dose. And then if you notice they're having a tremor, how
right.
soon after? And then if it's medicine related, you'll notice a pattern
Yes.
versus
And
because
that
the ticks are going to be random. Whereas the medicine's going to be like always when it's almost at peak or right away, or because it depends on what kind of impact it's having. If it's when it's completely doing its job, but now I'm completely devoid of dopamine, for example, I'm going to walk around shuffling my feet and I might have a tremor and I can't think. That medicine's too strong, or
yes.
it's the
No, it's
wrong one
true.
for me. Yeah. So
You know,
journaling the time and the effect together is helpful.
definitely. Not only that, too, another good point you made is not just for yourself, if you're advocating for children or
Yeah,
family member or something like that, that you yourself are helping, you observing and being aware, for example, when my son was younger, if he was on medicine, all of a sudden he wasn't hungry, right?
yeah,
That
yeah.
is he not hungry because he's really not hungry, or is it the medicine is making him lose his appetite,
Right,
right? Or
right.
all of a sudden
Or vice
tired.
versa. Yeah,
Right, yeah. Or he's tired. Is he really tired, or is the medicine making him drowsy? So those are the things, like you said, the timing in which you give him
yeah.
the medicine. If you see the
Matters. It
pattern,
matters.
then you'll start to see, wait a minute, I think it's related to the medicine and not the other thing. But again, speak to your doctor to make sure everything is that they're aware of it, and then
Right.
everybody can share the information so they can move forward together with the best procedure in which way they need to go.
Exactly. And then as far as the journaling, the side effects, there's a difference between, oh, I'm just tired, I want to rest a little bit, versus I'm so tired, I can't even move, I can't get out of
Right.
bed, because those
Yeah.
are two different levels, two different
Yeah.
distinct side effects, which
Hmm.
both fall under fatigue. But so like you
Yeah.
might tell your doctor, oh, it's making me tired, I'm fatigued. No, it's making me so zonked out. I can't even
Right.
function. I can't move.
Hmm.
So you got to emphasize the level. You got to look at the level and emphasize the level of dysfunction or concern with your doctor. Again,
Hmm.
video goes a
Yes.
long way because they're
The
just looking at
fatigue.
the common, oh yeah, common thing is fatigue. Meanwhile,
Right.
like you might
You're
be
drooling
etching
on the
into
floor, right?
you might
Right.
be slipping into closer to the serotonin syndrome,
Right.
which could be
Hmm.
life-threatening
Yeah.
if you're not aware and then you let it go and it kicks into that level.
Yeah.
So those are things you need to be mindful of.
So maybe when journaling, you might want to put like on a scale 1 through 5 or 10 or whatever you want to call it. And that way you can say, my hand tremor was a 1 versus when it's a 10. Or like I was
Right,
drowsy, but I was at this number. And that way the doctor can see, wait, that's too high. You shouldn't be that high,
right,
on that
right.
scale.
And then the
Or
tremor
he'll know,
too,
they may know, you know what, maybe we need to lower your medicine a little bit.
or
And
try a
then
different
by
brand, or yeah.
exactly. So that's where they then will use their expertise to see which way to adjust it to make it work best if it is adjustable.
And then also, not just I'm having tremor, but is it just that like immediately after or for like a half hour, or is it amping up? Is it constant? Because those matter
Correct.
too. Because if it's
Yes.
just an occasional tremor or an occasional fatigue, like maybe an hour into it and then I'm back to
Right.
normal versus
Yeah.
all day, I feel like I'm wearing a sack of sandbag on
Hmm.
me and I can't move and I can't think. Two
Yes.
different extremes. So same thing with tremors or
Definitely.
any effect you're having, because the fancy names just mean it's a different type of level.
Yes.
And you'll learn that if you're a sensitive soul like me, you'll learn that when you talk to the doctors, oh, it's the same thing, just different to a different degree. And that's one of the reasons why they give them all these fancy names. But they
Hmm.
also give
Yep.
them all these fancy names so that the average person isn't looking for it and concerned about it or whatever. But Know
Right.
yourself.
Yeah. Exactly. Know yourself. That's the key. So again, thank you very much for sharing this topic. I think it'll be very helpful for people. And you can reach out to her. You'll see her information on the post. If you do have any questions, feel free to let her know. And I'm sure like if she doesn't have the information, she can refer you to somewhere else or go from there,
Definitely.
right?
Definitely.
So thank you so much. And I'm
And
sure
thank you
we'll
for
have
having me.
more. Yeah, no, I'm sure there's a lot more that we can learn from each other in this discussion and these type of topics. So, you're welcome back again. And
I appreciate
you
that.
know, yeah, definitely. And I look forward to talking to you again and have a very good evening.